Your blood type may not be the danger. The danger may be the pattern it makes easier to ignore. If you're type O, the first signal may show up in your stomach. If you're type A, it may show up when circulation is under pressure. And most people do not connect those signs to the same hidden pattern until much later. Most people think blood type only matters during a transfusion, a hospital, a surgery, a pregnancy complication. But for some people, the first effect may show up much earlier than that, not as a dramatic crisis, as a weak point that keeps reacting first. Your stomach, your circulation, your mental clarity. And that may be the real issue, not the label itself, the warning pattern your body may already be repeating. This does not mean your blood type controls your future, and it does not mean every symptom you feel comes from one biological label. But it may help explain why some body systems seem to show strain first, why some people keep seeing the same kind of signal in the same place. So this video is not about which blood type is best. It is about something more useful, what your body may already be showing, why those signals are easy to dismiss, and what pattern may matter more than the label itself. 2. And this is where the story gets more personal, because the body usually does not start with a dramatic warning. It starts with a system you keep having to manage, a symptom you live around, a reaction you normalize. For some people, that first system is the stomach. Maybe it burns after meals more often than it should. Maybe it feels irritated more often than it should. Maybe you keep saying you just have a sensitive stomach. Or maybe certain foods seem to hit you harder than they hit other people, even when nothing about the meal seems extreme. That kind of pattern is easy to explain away. Stress, spicy food, getting older, eating too fast. And sometimes it is one of those things. But sometimes that is not the most important part. Sometimes the bigger clue is not the discomfort itself. It is how often the same system keeps reacting. The same irritation, the same meal discomfort, the same burning, the same feeling that your digestion is never fully calm for long. In some research, type O has been linked with different gut-related risk patterns than some other groups, not as a final answer, not as destiny, but as part of why the stomach may become the place that shows strain first. And this is where people usually miss the signal. They wait for stronger pain, a clearer diagnosis, a moment they can no longer ignore. But the body rarely starts there. It often starts with repetition, a symptom you can live with, a discomfort you can manage, a pattern you slowly stop seeing as a warning. So if your stomach is the system that keeps reacting first, that matters. Not because your blood type explains everything, but because the first warning does not always stay in the gut. Sometimes it shifts into something quieter, your circulation. Some people can sit for hours and feel almost nothing. Others cannot. Too much sitting leaves them heavy, sluggish, off. Not in pain exactly, just not right. Maybe long drives hit you harder than they should. Maybe a desk day leaves you feeling strangely pressured or drained. Maybe your body feels like it loses momentum faster than it used to. That kind of signal rarely feels dramatic enough to scare people, which is exactly why it gets missed. For some people, especially in blood groups more often linked in research to clotting-related tendencies, the body may be a little more vulnerable to circulation stress than it appears on the surface. That does not mean danger every time you sit still, and it does not mean your blood type is a verdict. But it may help explain why your body seems to handle stillness poorly, or why vascular strain builds more quietly than expected. And that matters because circulation problems do not always begin with pain. Sometimes they begin with friction, a sense of heaviness, a feeling of pressure, a slow, subtle sluggishness that is hard to describe. You keep functioning, you keep moving, you keep telling yourself it is probably nothing. But sometimes the first warning is not that something hurts. It is that your body no longer handles inactivity, stress, or recovery the same way it used to. That is a different kind of warning. and it is easy to miss because it hides inside ordinary life. The danger is not always what happens when you are active. Sometimes the danger is what builds when almost nothing seems to be happening at all. And for some people, that quiet strain shows up at the edges of the body first. Your hands, your feet. If your hands and feet are often cold, if you notice tingling, numbness, or a strange low-level circulation feeling that comes and goes, that may be easier to dismiss than almost any other warning sign, because it feels familiar. You have had it before. It passes. It does not stop your day, so you assume it cannot mean much. But familiar does not always mean harmless. Sometimes familiar just means repeated. For some people, certain blood type-related tendencies may line up with the way inflammation, circulation stress, or surface-level vascular signals show up in the body. Again, not as the full explanation, not as destiny, but as part of the pattern. And that pattern matters because the body often reveals internal strain at the surface long before it becomes obvious anywhere else. Cold hands, cold feet, tingling fingers, numbness that comes and goes. Small enough to ignore, repeated enough to matter. This is where many people wait for real proof. A more dramatic symptom, a more serious feeling, a clearer warning. But the body does not always work like that. Sometimes it gives the same quiet signal again and again because that signal is the proof. And then the warning shifts again, not to the stomach, not to the hands, to the way you think. You feel slower, foggy, mentally flat, not confused enough to panic, just not as clear as you used to be. You lose sharpness earlier in the day. Stress hits harder. Recovery feels slower. You forget small things more often. And because none of that feels dramatic, you blame it on life. Bad sleep, too much work, too many screens, getting older. And sometimes that is true. But sometimes the body is showing strain in a way that does not look physical at first. When circulation, vascular stress, or system-level strain builds quietly over time, the brain may be one of the first places where some people feel it. Not with a crisis, not with a collapse, but with a drop in clarity, a subtle feeling that your mind does not feel as clean, steady, or responsive as it should. And that kind of warning is especially dangerous because nothing on the outside looks wrong. Sometimes the body does not warn you with pain first. Sometimes it warns you with clarity. And if you are only looking for dramatic symptoms, you can miss that signal for years. Which brings us to the part most people misunderstand. The label matters, but the pattern matters more. Your blood type is not the warning sign. It is not the symptom. It is not the verdict. It is one piece of the terrain. What matters more is what keeps repeating. The same stomach irritation, the same circulation heaviness, the same tingling, the same brain fog, the same feeling that something is off, but never urgent enough to force your attention. That repetition is what turns interesting biology into useful self-awareness. Two people can share the same blood type and still feel completely different, because the label may shape the tendency, but the repeated body pattern is where the warning becomes real. And for some people, the highest stakes blood-related issue is not something they feel every day at all. It is something that may only matter during pregnancy, during surgery, or in an emergency. That is where factors like Rh status can become important in ways many people do not think about until much later. Not as a daily symptom, as a hidden compatibility issue that only becomes visible when life suddenly raises the stakes. We will go deeper into that in another video, but it points to something important. Some of the biggest body risks stay invisible until timing makes them impossible to ignore. So the smartest way to use this information is not panic, it is attention. Not to one random symptom, to repetition. Watch what happens after meals. Watch what happens after long periods of sitting. Watch what happens under stress. Watch what happens in the stomach, the hands, the feet, or your mental clarity. Because one symptom can be noise, but a repeated pattern is often a signal. If the same system keeps reacting first, if the same strain keeps returning in the same place, if the same warning keeps showing up in a form you keep explaining away, that is worth taking seriously. Not with panic, with attention. Not with self-diagnosis, with pattern recognition. Because the goal is not to guess what disease you have. The goal is to stop missing what your body may already be showing you. The earlier you recognize a pattern, the more room you usually have to respond before the consequences get louder. Your body is not random. It has patterns. It has tendencies. And it often shows them long before damage becomes obvious. Your blood type may not be the whole story, but it may be helping shape where that story shows up first. So the question is not just what your blood type is. The question is, what pattern has your body been repeating, and how long have you been ignoring it? What's your blood type, and which signal in this video felt a little too familiar?